All right, let's go quickly over basically some quadrants, and these are regions that we use for diagnostic purposes. So a lot of times if somebody comes into the ER and they've been stabbed or they've been shot, someone will say they've been shot in the upper right quadrant, or we can further subdivide this into 9 regions, depending on how specific you want to be. But you also might have on physician's notes, you'll see the patient was complaining of pain in the right inguinal region. So a lot of times these are just quick references to where either a symptom or a trauma has occurred. So typically we have 4 quadrants, and you can basically of the abdominopelvic area, and the abdominopelvic region being the abdomen and the pelvic area. And we can basically take this muscle here, which is the rectus abdominis, that's your 6-pack, and this will be sort of one of our defining landmarks. So if you go right to the midline of the body, right through the navel, then you can draw this line here down the midline of the body, and then you can draw a line perpendicular through it through the navel, and this will divide the body up into the upper left quadrant, the upper right quadrant, lower right quadrant, and lower left quadrant. A very simple naming scheme here. And remember, you're always referring to things in reference to the patient, not to your perspective. So the patient's left is going to be your right, and vice versa typically when you're facing the patient like this. So always keep that in mind. Now you can further subdivide these regions. Instead of using the 4 quadrant system, you can use the 9 area system. And what you do is you take the borders of the rectus abdominis and use those for your lines, and then right about this crease in the rectus abdominis, you would draw your upper line, and just below the belly button, right above the hips here, what we would call the ilium, you draw another line, and then you can describe 9 regions. The umbilical region being the one where you have your navel, your umbilical region. Below that is the hypogastric region, the pubic region. Above that, the epigastric region. If you think of the word gastric, it pertains to stomach. Then on either side of those, you have left and right regions. The upper left and right regions are the left and right hypochondriac regions. Then below that, you have the left and right lumbar regions, and if you think about the back wrapping around, this would wrap around in the area of the lumbar spine. And then you have the left and right inguinal regions, going back to our regional anatomy. These are also known as the left and right iliac regions because you have a bone here called the ilium, and right here is the iliac crest, or the crest of that bone, and that sort of defines these 3 regions. And this is important, especially in the ER, or when you want to make a quick description of where a patient's symptoms or complaints are, because underneath you know where the organs are. So here is a nice picture of sort of where the underlying organs are: your liver, your stomach, your large intestine, your small intestine, and here's the gallbladder. Right about here's the pancreas. Here you can see the urinary bladder. And right around here, I'll show this to you a little bit better, is the appendix, which is really part or comes off of your large intestine. And I'll actually show that to you over here using this book. Because I do not have my anatomical model here, I'm going to use this book for the anatomy, and that's this one right here, simply because we do not have the anatomical model here. So here you can see pretty well where the organs reside. Here is the rib cage, and you have the diaphragm here, and the diaphragm moves a lot. We'll see the diaphragm in a little bit more detail a little bit later. This large organ is the liver, and you can see how it dominates the right upper side of your abdominopelvic cavity, and we'll talk about body cavities in a little bit more detail in a bit. This large brown organ is the liver. Within the liver, you have this green pouch, which is called the gallbladder. You can see part of it actually right here would be visible if we were to open this up. Here's the stomach, and you can see it's sort of underlying the liver, and then this part would be exposed if we opened up this area here. And then here's the pancreas. Right here's the pancreas. That's this yellowy organ right here. And all of this twisted tubular mass here is the small intestine. And then surrounding it is the large intestine. So the large intestine you have this area right here, which is where the small intestine joins the large intestine. This is called the cecum. And coming off the cecum, you have this thing here called the appendix. And the appendix is sometimes known as the vermiform appendix, and vermiform just means worm shape because it looks like a little worm. And as you know, if something gets in there, it can become inflamed and cause problems, and sometimes it has to be removed. So this is the large intestine, and it's further subdivided into the ascending colon, the transverse colon, the descending colon. Back here you would see the sigmoid colon, and then it goes out, food waste goes out through the anus. So these are the organs, and that's why we have these sort of regions, so that physicians and clinicians can quickly identify from symptoms or pain where an underlying problem might be.